Last night I was doing a procedure in the operating room here. The lights went out as I was taking a swipe of tissue. The consequence of that happening in a medical situation, it can be lethal.
La semaine dernière, j'ai travaillé la nuit, il n'y avait pas d'énergie. Pour cela, j'ai obligé de prendre mon téléphone. Avec mon téléphone, je mets dans ma bouche pour faire un accouchement. On ne devrait pas faire ça.
The lights in the operating room were broken last year, they're still broken. The air conditioning can come and go. It's hard to work in that condition. Anesthesia machines, blood gas machines, suction machines, that you need electricity. Even with full power, it doesn't always work. It's not the same power I have at home. I'm digging a little bit more. Things go down a lot. Even when the power is not going down, an electric socket may not be dependable. Electric socket with two plugs, one plug may work, one plug may not work.
If you have a delicate instrument, especially a laboratory instrument, this could be a catastrophe, because the electricity sometimes is very unstable. Without reliable electricity, it's very difficult to go forward and develop the system like it should be.
In 2009, USAID and the government of Haiti launched the Improved Health Facility Infrastructure Program. The objective of the program was to improve the quality of energy systems throughout health facilities in Haiti. Most of Haiti's 900 health facilities suffer from poor quality power. For larger grid-connected facilities, these facilities must rely on on-site generation, storage. Some of Haiti's smaller facilities have no grid power at all. These facilities are completely dependent on on-site generation technologies such as solar and diesel, storage such as batteries to provide their power.
We're doing this project really not only in Port-au-Prince, but actually scattered throughout the country. We have over 25 different installations now operating. And in all of this, we're really focusing on two specific areas of work. First one is technology, and the second one is institutional development. We characterize hospital loads in two ways: critical loads and non-critical loads. Critical loads are those that are crucial to the operation of the facility. These can further be grouped into contact critical loads and no contact critical loads. A typical hospital in Haiti is supplied by Haiti's national electric grid. The grid supplies power to the non-critical loads and the critical contact loads. At the same time, the inverter charger is charging the batteries, storing up energy for later use. A second inverter, the no-contact inverter, is always isolated from the grid. The batteries then act as a buffer between the poor quality power provided by the grid or generator and the sensitive laboratory and IT equipment. If the grid power is down and the generator is out of service, then the hospital relies entirely on the batteries. Furthermore, solar PV panels can be installed as an additional source of power to help charge the battery bank and offset part of the generator diesel fuel consumption.
Fuel is very expensive here in Haiti. I believe that someone told me it was $4 a gallon right now. If you're going to a remote site, then you also have to travel that far, so you have an additional cost of travel. Yesterday we visited a hospital where the director said that 25% of the operational costs actually went to purchasing that fuel to power the hospital. So if we can cut that, all that can be redirected into medical supplies.
On my first trip down to Haiti, we visited the main hospital in Cap-Haïtien and spoke to a doctor that was working in the neonatal ward. The hospital hadn't had any grid power for the past 2 months and was completely dependent on its own diesel generators. The hospital administration had decided to only run the generators for 12 hours a day in order to save money on fuel. The doctor mentioned that 3 babies in the past 2 weeks had lost their life because of the lack of power. There are many technologies available that can help to reduce the cost of on-site generation. At very large facilities, integration of solar and battery backup can help bring down the cost as compared to pure diesel generation. There's also smaller solutions such as solar suitcases, which are being effectively used by NGOs such as Mama Baby here in Haiti.
We do have a generator. We try to use it only an hour a day. It is extremely expensive to run. But last night, for instance, we turned it on because we had 2 mamas in labor, and it was a very difficult, very long labor, and all of a sudden the generator stopped, it broke. 5 o'clock, it is pitch dark. We call it the suitcase. It is a big yellow box, and it is such a blessing. If we did not have that, I don't know what we would do.
Even though the grid is not on 24/7, even if it's on for several hours a day, we find that the most cost-effective way of charging these battery systems and having them available is to use what grid power you can. There are facilities that are completely off-grid, that are not connected to any kind of electrical grid at all. There, we're limited to a generator, and that's where solar energy makes a lot of sense.
Solar diesel hybrid solutions really represent the most sensible solution. You're able, when necessary, to turn on a generator and have power, but the idea is to minimize that power.
So 5 years ago, when we started this project, we thought, piece of cake. We'll come in, put in solar installations everywhere, improve the power, and kind of take care of all of those needs. Well, the reality on the ground was quite different. The upfront costs of solar energy meant that we could only cover a fraction of the facilities that we were able to do with battery backup power systems. And since we were focusing on maximizing the coverage and the benefit to the health facilities, we chose to do that rather than going with solar. Today, things are changing. The cost of solar energy is coming down. There's greater experience with solar energy installations, and we're actually looking at going back and adding some solar panels on our existing installations to make them a little bit more cost efficient. But however you power these systems, whether you're talking about grid or solar or generator, none of that really matters if the electrical wiring in the buildings is not up to par. Unfortunately, we found serious deficiencies in the wiring pretty much consistently throughout Haiti because of poor practice, lack of budget, and other maintenance problems in the hospitals. This, in turn, has led us to not only work on the backup side, but to work on the wiring side. And an important aspect of IHFI has evolved into an actual rewiring of electrical systems, lights, fans, switches, and outlets throughout these hospitals in order to provide safety, security, and greater illumination and just an overall better environment for the patients.
Nous avons eu un souci de sécurité des lignes électriques à l'hôpital. En 10 ans, nous avons eu droit à 2 incendies qui se sont déclarés à l'hôpital et qui ont détruit des pavillons. Et de la USAID, une étude sur la sécurité des lignes. Et le résultat était vraiment alarmant, au point que la firme qui avait fait l'étude avait recommandé de refaire en entier le système électrique. Une partie de ces travaux a été déjà réalisée par la USAID au niveau de la maternité et au niveau du pavillon des résidents de l'hôpital. Mais il y a un gros travail qui reste à faire pour tout l'hôpital, pour sécuriser ces lignes.
Nous avons fait un pile temps dans la maternité, un pile temps, mais le docteur était patient ensemble avec moi et puis je eu lumière. Après l'accouchement encore, pas de peur, j'ai eu lumière pour veiller petit bébé et puis lumière pour faire tout le bagage parce que j'ai eu un pile douleur malgré que je prends médicaments, même j'ai couché, pas tellement peur, j'ai couché normal parce que j'ai eu lumière pour te veiller petit bébé pour moi.
So as part of this rewiring and electrical refurbishment program, we've worked in the largest hospitals in Haiti, starting with the teaching hospital in Port-au-Prince, where we've done the surgery ward, the maternity ward, the emergency room, all with new wiring. Similarly, in Justinienne, the large hospital in Cap-Haïtien, and in the Northeast, the hospital at Fort Liberté.
Tu sais, dans mon travail, maintenant ici, puisqu'on est à la Fort Liberté, il y a une plus grande responsabilité. Mais le total, en gros, on devrait installer près de 270 lampes et environ plus de 80 ventilateurs et plus de 350 prises. Et j'étais venu à 7 h du soir, il y avait beaucoup de gens, il n'y avait pas d'électricité, ça faisait noir. Et j'ai dit que la lumière soit. Et puis, c'est allumé, vraiment, ça a fait et le comble de certains, tout le monde était venu dans l'assemblée. Voilà, que la lumière soit, Dieu a dit, c'était la parole de Dieu quand même dans le livre de Genèse.
So certainly all this technology is wonderful and very useful, but what we really need to do is to integrate it into the operation of these facilities, and that is where the institutional development comes in.
It's been challenging because, you know, these hospital employees, these doctors and nurses, they're not thinking about energy. They're thinking about medicine. They're thinking about saving lives. That's what they care about.
In Haiti, we quickly realized that multiple stakeholders were required to improve the sustainability of energy systems at health facilities. The IHFI program was designed to work with these stakeholders. We have trained private sector companies on the proper design and installation of systems, have worked with local health facility technicians on proper operation and maintenance of the systems, have trained the hospital administrators to improve their understanding of the long-term requirements for the operation and maintenance of these systems, and to assume ownership of the systems once our program ends, and have worked with the Ministry of Health to make sure that the proper financial and technical resources are available to the health facilities.
So the hospital technicians are really the key entity with whom we've partnered in order to make sure that these systems are properly installed, operated, and maintained. And we've done this through a series of training courses at different levels. So to date, we've trained over 200 electrical technicians that are employed by the health system, assigned to hospitals, and who are now operating and maintaining these systems that we've installed.
What we are doing is trying to create a curriculum that really addresses the problems that the technicians may encounter with the inverter battery systems. And so a lot of our training has to do with how do you maintain batteries, how do you maintain the inverter system, what happens if an error comes up in the system and the whole system shuts down, how can they address that? The types of batteries that we're using on these systems are flooded batteries, and they have liquid inside them. The technician has to go and add water, distilled water, to the batteries. So that means that we have to have a really well-trained technician that knows to, and that is reliable, to go and fill up the batteries. Batteries are the weakest link in your system, so they take so much care. You have to make sure that the terminals are free of corrosion because it adds resistance to charging and discharging of the batteries. Everything kind of has to be right, so that's why the training is so important.
We have worked closely with the project management unit of the Ministry of Health and Population in Haiti, and they have allowed us to actually have access to their training facilities, but also organize several of our training sessions.
Je prends 3 formations avec la Tétratec. C'est vraiment extraordinaire pour moi-même. Première formation, je plus parlé moins de comment je suis capable de faire un service dans une batterie et comment je suis capable de protéger tête moi par rapport à danger que la batterie a gagné là-dedans. Et moi, j'ai vraiment maîtrisé ça et j'ai appris comment prendre le soin à la batterie et batterie pour me changer de l'eau dans l'eau. Et comment pour me faire service dans bonne batterie et comment pour gérer le système bien.
They really get an overall look at the system, and then it goes over generator maintenance.
And I teach them exactly what to do every single morning. what they have to watch. We have to have, for example, the belt and check the oil, the water, the battery.
Pendant que je premier séminaire à Haiti Tech, je commence à comprendre plus. Parce que je suis des bails saisir, c'est après, pendant que je prends le séminaire, je saisir. Je plus de responsabilité.
When I visited the sites, I saw the level of skills that the technicians had really increased. The thing about Haitian technicians is that they have learned out of necessity under some of the hardest conditions. So they're great technicians. They can put anything together and make it work.
We have made a lot of progress through the IHFI program in building the technical capacity of a wide number of stakeholders that are going to be required to keep these systems running in the long term.
Mais la construction du système de santé n'est pas quelque chose que l'on peut faire seul. Il est vraiment indispensable que l'on puisse avoir de l'énergie, que l'on puisse avoir de la bonne formation pour les gens, que ce soit des prestataires ou les gestionnaires, pour qu'on puisse tous avancer ensemble et avoir un succès collectif pour le plus grand bien du peuple haïtien. Donc voilà ce que moi je souhaite.
This is a process. It's not something that's going to happen overnight. It's going to take years to do it. But I'll say this, that USAID is here for the long term, and we're going to do whatever it takes for Haiti to get up on its feet, because we believe in Haiti and we believe in the Haitian people.